Okay, so I'm excited about today's podcast, both because it is our first podcast here at Persimmon, and more so because of our guest, Tim Cooley. We're going to be talking about the future of healthcare, angel investing, and Tim's advice to entrepreneurs and angels looking to work with startups. And for our audience, Tim has been a serial entrepreneur and founder of health focused startups, general manager of an accelerator before joining the other side of the table, currently as executive director of Park City Angels. Tim combined both of those perspectives to literally write the book on pitching startups called The Pitch Book, which is a step-by-step guide to raising capital from VC and angels. So Tim, welcome to our first podcast, and thank you.
Yeah, thanks for having me.
Awesome. Yeah, happy to have you here. So Tim, another fun fact is that we went to high school together in Eugene, Oregon, and we both left after high school, and I bumped into you over 20 years later at the Innovator MD conference where you were giving a master class on how to pitch healthcare startups. And I'm still blown away that we both ended up working with digital health startups around the same time. And I'm curious, what was your journey to get there?
Yeah, so it was crazy when you messaged me, that was awesome. Yeah, so I'm not sure why you left Eugene, but I left because I joined the military. And then I did that for 5 years. Mm-hmm. So that took me down a crazy path. I got back in my first career path out of the military. So I used to build jet engines. And then I went down the sports medicine route. I ended up working at the University of Arizona, then the San Francisco 49ers, and then ended up at the University of Utah working with the swimming and diving team. And then did that for a couple of years. Mm-hmm. Ended up starting my first company, which later I sold. And all through the middle of all that, you got your side hustle and then your day job. So my day jobs were mostly around marketing. Did that like SEO, link building, that whole world. I learned web develop. I learned all the things.
Right.
And then I went back and got my MBA. And I started doing healthcare consulting during that time. Once I finished my MBA, I ended up doing a second startup, which was in the digital health space, trying to get people to walk more. Mm-hmm. And then I couldn't raise capital. And so I decided, if I didn't know what I was doing, might as well go learn from experts. And then I ran an accelerator and then ended up being involved in the investment side of things. So my career kind of went all over the place and ended up where we're at today.
Oh, man, that is epic. So, yeah, I have a couple of off-topic questions for you. Not off-topic, but I was going to ask you to compare Utah and Oregon in all kinds of ways, but I'll stick with the one that matters, which is, are you still first and foremost an Oregon Ducks fan?
Sure. It's weird. It's being in the sports world. Like, I just love game. Like, I don't care what team it is. So because of my job, I kept switching. Like,
right.
I'm going to I root for the team where I'm at. So when it's a Ducks and a Utah game, I just want it to be a really good game. That's all I care about.
Okay. Got it. Okay. Yeah, no, I've been, biased my whole life, and I think I'll continue to be so at the college level. Pros, I'm the same way. Yeah. Who's the most entertaining team on the given season. Okay. And then next question is, you've been I would say, hardcore engineer with designing jet engines, and you've been a software engineer. How would you compare those?
So it's interesting. So building an engine is much easier than writing code, honestly. Somebody else did all the hard part, and so you just got to put the screws in the right place. I mean, there's like documentation and stuff like that. When I got there, like literally, it's kind of like all startups. All the bolts and things were in a bin, and they were like, go find the one you need. And obviously you can tell that's completely inefficient. So by the time I finished, we put like all the things where they're supposed to go. Like if you want to work on the front of the engine, all the pieces are here. And I felt like I've taken that through my whole career, and didn't know what that was, right? It's called lean manufacturing. But at the time, I didn't know that word, nor should I have. They were like, get the plane flying. And then throughout my career, I always dabbled, even back in high school, with software engineering. So I used to build websites for people, even back in like the 90s. And then I kind of like carried that through. I just thought it was so complicated that building engines is way easier.
Awesome. No, I'm just smiling because I built websites in the 90s and had gratuitous use of things like the blink tag, etc. That was perfectly acceptable to draw attention back in the day. No, it's interesting that you mentioned lean, though, because, of course, that's the Bible that, we tend to follow with the early stage startups that we work with, which is build, measure, learn. But the idea is to reduce the waste in finding the right product market fit. So prioritizing things like validated learning. Are you on the right path? And that was an eye opener for me, to be honest, in my first startup 13 years ago. But what I've discovered in focusing in healthcare is that lean has taken on a similar origin, but a little bit of a different manifestation in terms of process. So still reduce waste. But instead of reducing waste in what you prioritize for a startup, it's reducing waste within a health system and things like, okay, how long do people have to wait between, in the office or between visits and referral times and things like that. Have you encountered that personally much at all? Like these different versions of lean?
Oh, yeah, absolutely. I mean, first of all, you've got lean methodology and just the startup world, like you mentioned. Build, test, get your MVP out there as fast as possible, and then, try and break the whole thing as quickly as possible. What's cool in healthcare right now is I think a lot of people are approaching the whole system as a waste. Meaning, like, I'm working with a lady right now and helping her pitch her company better. And, like, she's reducing an entire building with an app. Theoretically, wow. Right? Like, That's crazy, right? She could, unfortunately, remove like 100 jobs with an app, and that's amazing. Right. No, that is amazing, and it's so, yeah. That's the dichotomy that as I've been getting into lean for healthcare to deal with, which is there's kind of two motivations that it could be, which is reducing waste, as in time spent on task and people. Or it could be reducing waste to the end of better outcomes to the patient. I can't remember who had the quote, but they said that a successful lean transformation within a health system was when everyone in that health system asks, how does this benefit the patient? Which would be awesome if in practice it's actually a guiding force. Totally. I totally agree. I mean, like in this case, I think that at least in her pitch, it's like 20 steps for the patient to get seen. In this whole thing, or she's in the transfer space, and in her thing, it could talk to maybe 2 people versus I think at least this 20, and that's incredible. Yeah, no, that is amazing. And I think that's one of those cases where the incentives align, right? So less work for people within the health system, which of course they're overburdened in so many ways, and then less time spent waiting for the consumer, for the patient. That's great. Yep. Cool. So that is all very exciting, but I'd love to learn more about what you're doing now with Park City Angels. And I guess first starting at the top, can you tell me about angel investing and what it is? How is it different than, say, friends and family, debt, VC? Yeah, totally. So at Park City Angel, I'm the executive director. So I do all the deal flow screening. I actually meet with 5 companies a week, but I screen up to hundreds. It just depends on that month. So I try to meet with anybody who's in Utah. That's kind of the charter that I've taken on. I think it's important for us to stay local if we can. But we also, if we get referrals, then we'll take them as well, from anywhere in the country. So that's what the group does. And as you said, they are different. So friends and family is probably the hardest and easiest money to come across because you don't want to ask your friends because it might fail. But usually they're the best ones to go to, especially if your product isn't built yet. So angels typically come in right after the product is finished being built. So I would say that it's best to go seek angel funding if you've got your first couple clients, maybe one. You only need really one, maybe two. You just want to say like someone's bought it, someone's using it, and we know how to grow it if we had extra cash. And then once you get a handful of customers, and you kind of really know what you're doing, you know how to get the next 100, that's really kind of when I say that early stage VC comes in. And then you go into that next round of funding when you're looking at different verticals and expanding the business. That's kind of how I would phrase it all.
Okay. Yeah, got it. No, that's interesting. That kind of maps to how we think about different stages of companies, which is, okay, either as an entrepreneur or an intrapreneur, you're in the show proof stage, which means, okay, I have an idea somehow through hook or crook. I need to demonstrate that it has value. It could be through prototypes, things that don't work, smoke screens, smoke tests. Or it could be through one pilot where people are telling you good things. And then there's that middle stage, which is becoming viable. So, turning that initial validation into an actual business where you can repeatedly go out and get some more of these customers and make sure they're the same as those initial customers. And then the third would be the scalability, which is just more of the same or expand the business with more products. And it sounds like you guys are very much along that path. And gosh, I would love to learn, actually, you mentioned that there's 100 companies you see in a month and there's 5 that you talk to per week. What is the difference between screening and meeting, or what do people need to show you to get to that meeting?
Yeah, so I would say a lot of it's kind of gut feel. So every group has their, I'm going to call it their thesis. That's the word they use. So they'll say we only look at healthcare or only digital health or female founders or whatever the thing is. They're going to kind of put a line in the sand. And a lot of that has to do with just the inundation that we get from so many people. So it's kind of like that first filter. So for us and for my role, it's Utah. Like I said, we'll look at others, but if it's a cold application, no one knows you at all, Utah is our filter. Okay, so every group has that. Whether they state it outright or not is up to them. Right. And so once I get the person on the call, then I start to ask, questions like, what are you doing? Is it a physical product? Is it a pharmaceutical or whatever? So after that, then we have the other filters. So like I said, for us, we typically like to see that the product is built. And you're right in that early stage of customers. Obviously, the more customers, the better. It just de-risks the business for us as investors. And so things we don't really look at are like real estate. This particular group doesn't mean that the investors don't like real estate plays, but for this particular vertical of investment, we don't look at them. So it's kind of like, that's kind of how we do it.
Right. Interesting. And you talk about de-risking investments. And then there's the counter side, which is how much potential for either impact or home run swing does an idea have? How do you balance those two things of, okay, is this thing legit versus it may or may not be legit, but if they hit the ball, it's going to be a home run. How do you think about that?
So I like to do a balanced approach. So obviously not every company is going to have the potential of 100x, but that is one of the criteria is, could you, if all the cards fell properly, get to 100x valuation of what we're doing today? Then sure, we'll bring it in. And we have a lot of those conversations in the group after the people pitch. And it's like, man, if they hit this, it is huge. Otherwise, there's nothing there. And some of those are the fun ones to invest in. But then obviously you have your diversification portfolio. And so, I'll try and bring in something that has a clear exit path. If they get to $5 million, $10 million in revenue, there's definitely a buyer there. So I'll kind of try and balance it between those two ideas.
Okay. Yeah, got it. Yeah, that makes sense. And that, that matters for investors, where you guys get a windfall only when there's either a subsequent round of investing, you guys choose to cash out, or there's an exit that could be meaningful, for example, an acquisition, or going public, in that case. Okay. No, that's very interesting. And I know you guys, you don't do real estate, but you do invest in different spaces. So, for example, healthcare is one, and then it could be consumer is others. How is raising angel different for a healthcare startup versus a consumer or any other space? Like, what's specific to healthcare?
Yeah, so typically healthcare needs a lot more money. So let's say, for example, you're doing some kind of diagnostic. It's going to take multiple rounds of funding. You still need, and most people are probably aware in this space that there's like SBIR and STTR funding, so you can get government grants. But a lot of those don't cover like a salesperson, right? Like they have to be used for development, or they have to be used for a very specific
research.
Way.
Yeah. Mm-hmm.
Yeah, research or something. So you're looking for like this, like 2, 3, maybe $5 million to try and get the product past development into the hands of a few people, but you still have like all this research that you have to do. But then the funding runs out, right? So you just raised 3 million, product's still not in market. Then you go and raise another 5, 10 million, and then 20 million. And you're like 7 years down the road, and no one early investor has seen any kind of potential of a return. So that makes it really hard to raise capital. So you have to pitch home runs when you're talking about medicine, or
Right.
these therapeutics or whatever.
Yeah, I got it. And you've talked about traction before, and just, it helps to demonstrate that you have one customer, or you've gone from 1 to 5 before getting to an angel round, and certainly a VC round. Something with the companies that we work with maybe underestimate within healthcare is how hard it is to navigate into that customer number 1, and how hard it is to go from there into a customer number 5. Can you comment on the go-to-market challenges, tips, observations that you've had for healthcare startups?
Yeah, totally. So I'll give you some tricks here. So the best trick that you can do is get to the point where you steal your competitor's salesperson. Like that should be your first hire. And you should be wooing them like crazy from the beginning. Like, dude, Chris, I know you're doing a thing, but like when you're ready to jump ship, I need you to come to me, because they've got all the relationships. They know how to navigate the thing. Like an experienced salesperson in that world is invaluable to a startup. The second thing that I think people don't do enough in the healthcare space is have a direct to consumer pathway. With where medicine is at right now, I know everybody wants to chase the reimbursement and all that stuff, but it is super complicated and very difficult. If you go direct to consumer, you can test a lot of these assumptions really, really quickly. And while you build the FDA version of the product, and they could be the same, but you just change something. And so you have like these 2 products going to market simultaneously. And I wish people would do it, but as you can imagine, very few researchers have direct-to-consumer experience. Like you see this happening right now in like the ED world. Mm-hmm. ED is direct-to-consumer, mm-hmm. and it is crushing, right? Mm-hmm, mm-hmm. There's women's health issues that are going direct-to-consumer. I guess a lot of people aren't familiar with how to do it, and so that's another one that I would do. The third way I would say traction can be accomplished in healthcare is to have the people who would use it invest. So if you're doing a dermatological device of some sort, and you don't have 20 dermatology doctors investing in you, like that doesn't even make any sense. Like you should have hit up every single one in your development process and being like, do you like this idea enough to throw in $25,000? And that's a really good traction point I've seen for angels or even early stage VCs, when you're like, look, we've got 10 people who are not only investing, but waiting till FDA approval so that they can use it.
Yeah, got it. Oh man. So I have a couple of follow-up questions on that. So one is around metrics, and then the other is around direct to consumer in general. So I mean, first you mentioned metrics for traction. What is traction in your world by the time a company is pitching you? Like, what do you need to see? How do you quantify it as, let's say, a healthcare startup?
Okay, so let's go back. So one of the big things is, and people don't realize, is that investors don't want to look stupid. That's their biggest fear. They want to go talk to their buddy on the golf course and be like, look, I just invested this really cool idea. It's worth like $1 billion, right? That's the dream conversation. So they use traction to kind of alleviate these like stupidity markers, right? Like I can invest in you, Chris. I know I've known you for a long time.
Right.
And so that's a traction point, like just the time we've known each other. But for the most people, if you are unaware of the entrepreneur, it really comes down to these like critical things like, do you have customers? That's a traction point. Is somebody else investing you? So do you have a lead investor? You know, let's say you're raising 500K. Do you have half of it closed already? You know, so we talked about friends and family. Friends and family in a lot of ways can be the traction that you're looking for on a fundraise when you're super, super early, right? Like we're just trying to finish off another $500,000 and we closed 200K already. It could be partnerships, could be another attraction. So you're like, look, we've got a beta that's running out of Intermountain Healthcare. It could be strategic partners. So for example, like, let's say Cerner gave you 100K as a pilot. Clearly they're interested in the possibility of whatever you make. You know, so in each one of these bigger organizations has a investment arm typically. Or they're associated with some group, you know, like Epic is Intermountain Healthcare's
right
affiliation.
Right. Got it. Yeah. So you have to work through those more organic ends, or you need to find someone who has those relationships already. Might be a longer slog.
Yeah, that's why that, like, we call them gray hairs, right? Gray hairs on the team are super important, especially in this industry, because they've done it before, you know, and a lot of people, we see this a lot. They'll be working at, you know, Epic or whoever and been launching products. But when they go out on their own, it's a completely different thing, you know, like you don't have an unlimited budget. You don't have a team of 9,000 that are trying to make money, you know?
Yeah, no, absolutely. So I do want to come back to the direct-to-consumer later, but since we're talking about what makes a pitch successful in terms of, for example, traction. Now, in the pitch deck book, you share that in your 10 years of experience raising money yourself and years under your belt of funding companies yourself, that it's never the idea that got funded. So can you tell me if it's not the idea, and what beyond traction does get things funded? What's a minimum viable type of pitch?
It's usually the execution of the entrepreneur up until that point, right? So like there's lots of cool ideas and you're just like, oh my gosh, I come up with stupid ideas every day and they're all great. They're all $1 billion ideas, right? It's not true, but you know what I'm saying? So you get this idea that comes in and then you're like, so what have you done so far? And then they're like, oh, well, we launched an MVP. We've got 30 people using it so far. And you're like, oh, these people hustle. Like there is something cool about watching them in their element trying to get this company off the ground, you know? And so when you hear someone talk about all the things they've accomplished with basically nothing, you're like, oh, I can see why if I gave you $1 million, you're the person that's going to make this happen. Because one, you're a good steward of money. I trust you, you know, like all of these things.
Got it. Yeah, no, that makes a lot of sense. And something I've heard before is, you invest in the people, not necessarily the idea, not just the traction, but people that you believe in terms of their either experience or their grit and resourcefulness that they're showing. So that's great. So I do want to pull back just meta level. You mentioned direct to consumer because that's something that we've been hearing about so much lately, is that, like the graveyard of healthcare startups is really littered with these companies that promise programs to providers or health plans, payers, and they never bore fruit because at the end of the day, the people would not use the thing that enabled that type of quote unquote patient engagement, right? Or that type of program to be effective. And what we've heard is this kind of flipped model, or it reminds me of flipped classroom from Sal Khan and EdTech. But this flipped model of, hey, no one's going to believe you anymore because they have been through the rodeo with the CCM and now RPM and now RTM of all of those things are great in practice. Yes, we can bill for it, but it doesn't matter at the end of the day if the people don't use the thing. I'm kind of curious as to your thoughts around this. Okay, let's validate with consumers first and then work backwards into who can actually pay for this thing at scale if patients engage.
Yeah, totally. So, I mean, let's just take Noom, for example, right? The health and wellness app. Killing it, right? But their go-to-market strategy is dialed, right? They're a behavior change platform. And I don't know their story, but we could make one up and say, and this is what almost every digital health platform's out there is like, look, we can change behavior. And they're like, well, prove it. And then they're like, well, we need $5 million to run a research study. And they're like, why do you need that? Like, all you need to show me is how many people downloaded and use the app every day. Like, that's all we need. And Noom is like, I mean, I don't know if you guys have ever downloaded it, but like it's like it costs us $18.36 to acquire you as a person. Like, do you want to pay that or do you want to pay the full amount? And you're like, well, that's pretty cool. Like, you have this dialed to a number, and I think that takes special people to be able to do that. But there's so much out there. I think there's just so many other business models people don't use in the healthcare space that are direct to consumer. Everybody wants the healthcare system or the employer to buy your thing, but at the end of the day, there's a person who has a problem, and they're willing to pay for it. Like, they're willing to pay for a solution that works. It's kind of like back pain. There's a company here in Utah called Chirp. It's kind of like a little circle that you roll out your back on, and I mean, I think they did something crazy like $90 million last year or something. It's like, I have back pain. I will try that. Here's $100. Like, it's that simple. And I think when you're in the healthcare space, you forget that that's an option.
Yeah, no, it's super fascinating. And you could see it coming to literally malls. I was at a mall, maybe it was yesterday. I think it was yesterday, where there's a LASIK surgery center in the mall. That was really interesting. And then there's this movement of, okay, your providers and insurance companies are not taking good enough care of you, right? They're treating you when you're sick, not keeping you well. And now there's these waves of, let's say, direct primary care or wellness coaches, or your, mindfulness guru that you may have that are really oriented around your long-term health and prevention and behavior change. So I think that's very interesting that people are starting to now get to decide between this system where all of the incentives seem, if not misaligned, at least, not aligned towards saving people money for the outcome, and they get to choose. So I think that is a great trend that you brought up.
Oh, totally. Well, and you look at I think our generation was this flip, right? Because a lot of people don't realize that healthcare wasn't like this 40 years ago, right? Like, you went in, you paid your tab, you walked away, and you did the billing, right? Like, you sent your healthcare, the reimbursement. And then once the doctor said, well, why don't we just take care of it for you? Some business model came around and we'll just take it. And then it went kind of crazy like it is now. But now you see a lot of business models where people are taking that back over. And so they're like, should I pay $500 a month for something I'm really not going to use? Right. I haven't been to the doctor in years. Why? That doesn't even make any sense. I know it's an insurance, but I would much rather just pay when I need it, So you have things like Aflac and things like that, but for catastrophic, and I'm like, that makes sense. If I break my arm, I need help, but if I have a sniffle, But you can see this too in a different way. So it's the education side of things. So pharma is killing it, right? Even though they're through your physician model, they're 100% direct to consumer now. And you can hear them on the radio. They're just educating you on this problem you might have. and you have to finish the conversation with your doctor. But it's like they kind of paved the way for this new type of care in a lot of ways.
Yeah, no, definitely. No, I'm just smiling because they all have that master of reading the fine print really quickly so nobody can ever hear it at the end of the commercial when you're watching it. Yeah, no. Yeah. I want like that button for our business meetings, actually. Right? Just someone to come in and read all the stuff at super speed.
Cool. Throw at the end of this, like, all the data I said may or may not be true.
Right, exactly. And it's like, okay, if you go with our service, then you could get, diarrhea, loss of weight, nausea, and perhaps death. It's like, oh, okay.
Perhaps death.
I just want software engineering. Yeah. Okay. Man.
That would be so funny, though.
Right.
Yeah.
Yeah, we'll try that on some email footers or something. See if anyone actually notices. Yeah. Cool.
Oh man, they're like, how do I get diarrhea from coding? You're like, who knows?
Oh
it
yeah.
Could happen,
well, yeah, I'm pretty sure I've gotten it from coding back in the day, but yeah, that's more anxiety related.
Also British.
Yeah. Right. No, yeah, that's the Domino's pizza at 1 a.m. issue, not the coding issue. Yeah. Okay. Right. Cool. Okay. So circling back to the startups that you work with, would love to know actually some of the tweaks that companies can make, in particular healthcare startups, but I mean, really anyone. Like if you have any boots on the ground experiences of companies that didn't hit it out of the park the first time through with you, but or someone else, and they were able to tweak things, reorient, remix without pivoting necessarily, and then it made sense.
Yeah, so there's a company I'm invested in. It's called GiveGo. It's not in the health space, but it's and in the original pitch, it was a coaching app. So you would film yourself golf, you would send it to a professional golfer, and they would kind of mark up the video and tell you what you're doing wrong. Nothing wrong with that business model. It's been done a million times. And it just doesn't really work long term. It takes a lot to make that really happen. So we were talking. The guy's name is Willie Ford, great friend of mine, and one of his clients is actually Mastercraft, so the boat company. And they are the subscriber. And they said, look, anybody who buys a boat from us gets X number of credits to our professionals. So I was like, well, this is a really interesting use case. Like, the brand is the buyer, and all they're trying to do is facilitate the conversation between these pros that they're already paying. And then the consumer, like imagine, and I don't know, I'm going to make up something here, but imagine if you bought some really expensive golf clubs and then you got, connected with Tiger Woods to fix your golf swing. Like, how rad would that be? Or like, like Matt Jones, I watched some bicycling things on YouTube. Like these guys, I bought this bike and now he's going to coach me on how to do a backflip. That's pretty rad. Like, I think that's the next level of influence, but it took listening to the business model, testing out different assumptions, and then when the true business model appears, communicating it that way, right? Like the first business model, still the same thing. You record yourself, send it to a coach, but now you actually know who the buyer is, and you can communicate what the buyer really, really wants.
Yeah, no, definitely. That makes sense. I would love Bill Gates to do my code reviews, for example. Yeah,
totally.
Yeah.
Like, let's go.
Yeah, exactly. No, it's interesting. And yeah, no, I've seen a lot of these companies that use the AR AI to try to break down different physical movements. But then you look at, let's say, the masterclass type of model where it's less about the content. It's more about who you're receiving the content from. So I think that's a really interesting tool.
And the popularity of Cameo and some of these other like celebrity type things is pretty cool. Like, I don't know.
Yeah, no, I think it's absolutely incredible. And, we've been taking master classes from whomever it is, from cooking to music production from Timberland and all kinds of things. And I don't know, it's just, it's a different experience than reading yet another tutorial or some other method of learning. It is feeling like you're getting it from a master, whether they're more qualified or not. You feel like there's an inside scoop.
Well, not only that, but it's the interim, right? Like you interacted with a brand, and now the brand's facilitating that conversation. Like that's like, imagine if Pepsi ran a contest, and you could have a conversation with one of their athletes. Like that's cool. That's a cool brand experience.
Yeah. No. Yeah. Absolutely. Right on. Okay. So let's see. Can you maybe identify any common gaps or mistakes that you usually see with, let's say, healthcare startup pitches or other pitches that are easily correctable if you kind of have the right mental model of how to position yourself?
Yeah, totally. So let's use healthcare because that's what we're talking about. One of the biggest issues is they start with the solution. So they come in there and they're saying, my widget does this I like to use this phrase, this polymer ligase 983, beta blocker. And you're like, what I don't know what that is. Like 99, you're the only one who knows what it is because you literally made it up. Like you're the scientist, you made up the term. No one knows what that means. And that actually floors a lot of angels from investing because it already sounds too complicated. We had a guy come in last month pitching a pharmaceutical, which we rarely ever look at. And he goes, okay, imagine this thing. You've got Pac-Man comes in and he bites this thing and his head's on the thing. And when he does that, we can kill Pac-Man and it'll kill anything he's eating. And I'm like, cool, I get it. Like, so simple, so beautiful. Right. I know what Pac-Man is. Like, it's just the simplicity of the model. And I think a lot of healthcare people, you spend so much time educating, and you want people to come up to you. And a lot of healthcare people need to realize they need to come down to, if a sixth grader cannot sell your product, you don't know what you're talking about.
Got it. Well, I thought of the ace in the hole for the next pitch that doesn't make sense is say, okay, that's all well and good. I didn't understand what you said, but can you tell me about the side effects? Anyways.
Totally.
Yeah. And then you can sell them that button that brings on the master of speaking quickly.
Yeah. That's the new venture. Let's go. Patented.
Right. Awesome.
Side effects may include. And it comes at the end of every pitch.
Exactly. So yeah, awesome. I mean, you've literally written this the book on pitching your startup. I would love to know, what haven't I asked, or what is your top advice that you usually give startup founders when they're looking to build a new startup or wondering what that next milestone in raising money is?
Yeah, I think the keys here are, so one of them is get help from someone who knows who's either done it before, been in the industry for a while. There is lots of competing feedback on pitch decks. I'll be the first to admit that. I think mine's the best, but the reality is it's like, you got to find what fits in your narrative and then what communicates what you're trying to communicate. The second one, specifically in healthcare, is you have to know your numbers. So I work with a group called Forecaster. It's a really simple tool for getting your kind of numbers put together. And it acts basically like a kind of a fractional CFO in a lot of ways. But tools like that are super helpful in getting you started, because a lot, especially in healthcare, because you are raising so much money and the revenue is delayed by years, you've got to have a really solid idea of how much money you actually need, what are your major milestones, and and all of that stuff. So I would say two things really is, make sure you're telling the right kind of story that other people can hear and understand, and then make sure your numbers really make sense.
Got it. Is there any encyclopedia of numbers that you should hit for different areas within healthcare that is out there? Like, for example, Paul Graham back in the day put out, okay, we need Y Combinator companies to be hitting 30% month over month growth, which means they double between 2 and 3 months, every 2 and 3 months. Is there like a guide on whether you're on track or off track in terms of traction?
That's great. Not from that I'm aware of. Mm-hmm. I mean, most people, traction is and especially in healthcare, is like a clinic, right? Like a hospital, right? It depends on the product, mm-hmm. But it could be just like, we've got 5 chiropractors using our thing. Cool,
right? Got it. Got it. Okay. No, this is a good one to unpack together, maybe, if it doesn't exist.
Yeah, yeah.
Cool.
I'm sure there's something out there. We just see them so early that usually it's not a thing.
Right. Right. Got it. Okay. So we've gone up through how they get screened by you, and then that meeting. Let's just say they check all the initial boxes. What happens after that kind of partner angel meeting where you determine if you're going to actually invest?
Yeah, so usually there's a part called due diligence. So it happens after the meeting. So this is one thing I'll take back a little bit. You're pitching to get to due diligence, not to get, no one's writing. I've never seen anybody write a check that day. So you're getting to the next meeting. The next meeting is due diligence. You'll end up building what's called a data room. So a data room is really all the documentation, like we talked about, your forecasts, your financials, like it could be your cap table, meaning who's all owns the company. It could be a whole host of other things, intellectual property, whatever. So you're going to send this whole bulk document to people. They may or may not read it. Many will. And then you're going to go through a series of meetings, and my advice is reply as fast as possible. Okay. If you can do it within the hour, do it. Mm-hmm. But a good time frame is no more than 24 hours. But anyway, so you go through that, and then at some point down the future, you get your term sheet, and then it gets signed, and then the funds get wired over.
Got it. And when you're talking about responsiveness, is that because it's just professional, or because it's yet another signal that you look for in terms of?
It's another signal. So I've seen a couple deals not go through because it took the founder a week to reply. Like, clearly this isn't important to you. And,
right.
And especially in angels, this is what people don't realize is it's kind of hobby investing. Whereas in venture capital, they are required to fund. They have to put money to work. That's their job. Whereas angels don't have that same mechanism of force.
Right. Okay, got it. And last question about angel investing is, I don't know, from the time you first hear from an entrepreneur to the time that a check may actually get written, what is that time period in terms of months or however long?
Yeah. So let's take our process. So let's say you applied today. I was able to get you into our screening meeting. So the screening meeting is the first Wednesday of the month. Then you did a great job. You killed it. You go to our general meeting. And so that's at the end of the month. So we're talking almost 2 months from today. And then our goal is to get a check written within 30 days of that final meeting. So we're talking about that's, a 90-day process given where we're at today. Other groups can be longer than that. I would say very few are shorter than that. So, that's kind of the process.
Okay, got it. Okay, well, thank you for that, Tim. And, you have your own startup experience on, I guess, that other side of the table as a digital health entrepreneur. You founded 2 companies, Random Breakfast, Cooley Fitness. And I was wondering, just to take one of those as kind of your personal war stories of what you've gone through. Can you give us your Random Breakfast journey in a nutshell? Yeah, please.
So Random Breakfast was a digital health product. Our goal was to get people to walk more. At the time, behavior analytics and things like gamification wasn't really a word when I started my first company, which was around getting people to come back and participate in exercise. So the first company, Cooley Fitness, was designed like Peloton today, back in 2010. So we kind of took what we learned from that. I turned it into a health and wellness blog that I ultimately sold. And then the second company, we took all the learnings from the first one. I partnered with some people who were in the game development department at the University of Utah. And we tried to do something really unique, really cool. And we were pitching it around the world, and people were like, no one will play video games and walk. That was the feedback we were getting. And we're like, well, we'll prove you wrong. So we built our first product, which was awful, but it got us some funding. Then our second product it was a huge, games are really complicated. Coding is easy compared to building a video game. And so imagine coding fun. Where's the document on that? It doesn't exist, by the way. Okay, so anyway, what we did, and this is where I learned about the pitching, was we kept trying to tweak our pitch to make it sound like our product was bigger than it was. Like, a hospital will pay for us because we can insert these ads, and like we were just trying every avenue of communication than what it was. Like, we were building a game company focused on a really unique niche in the marketplace. And I think if we would have done it differently and we would have been in like California or New York, things might have looked differently. But Utah, we just could not communicate. So that's what happened.
Yeah, no, it's super interesting. And I had a personal experience in a different domain with my previous startup for gamification. In that case, it was trying to get students to study. And what was interesting is that what worked from a gamification perspective was really those students that were already the ones that were helping other students that had this like intrinsic motivation for learning or peer validation. They were the ones that the gamification system like reinforced. So they shot through the roof in terms of engagement. For example, 98% of the other students' questions were answered just by 2% of the people, because they're that engaged and they wanted the validation and the scoreboard. But what I'm getting at is really, do you think gamification works? Depending on the person, right? Whether they're intrinsically motivated to do a thing or they're not, or what have you observed?
Yeah, so the answer to your question is yes and no, depending on like the motivation. For example, let's look at just everyone does leaderboards, right? I'm, 500 pounds, super overweight. You're really, really fit. You track background, you do all the things, right? And we're on the same leaderboard of walking. You go and walk 9,000 steps. I barely can walk 5. The effort for me was way higher than yours, right? Yet you're killing me. And there's no way I can catch up, right? It's just not possible.
Right.
So I think that when people who don't understand gamification put gamification into apps, it's usually done very poorly. So I think the majority of people do it very wrong, right? Like you mentioned, like how much those guys who don't study, like I wasn't a studier in high school. And so like, what would it have taken? What would have been the incentive structure? Like James Bond was a big deal, right? The video game. Like they didn't do skins back then, but let's assume they did. It was like, oh, if I did my homework, like, which I never did, then I got a new skin in Bond that was like only to those people who never do homework. Like that would be kind of cool. Like we'll take Fortnite today, right? There's got to be something else that's really, which I'm motivated by, which is why we went down this path of games. Like most games, even if it's a small game, like you still want a treasure chest of some sort.
Right.
So that we were like, well, what if you could just get a treasure chest by walking 500 steps? And for you, I know you walk 9,000, so that's not hard for you. So why don't I make it 10,000? It's the same incentive reward and almost the same nudge.
Right.
No,
that's interesting. So first of all, you took me down memory lane when you mentioned Bond. All about Odd Job with the golden gun. That's all I'm going to say.
Yeah, totally. Paintball mode.
Right.
And, yeah.
Man, oh wow, man. Not wasted. Spent so much time on that.
Learning.
N64.
It was educational.
Yeah, exactly. Learning. Have you seen those ads lately that are, I don't game for me, I game for you. And it's a doctor, it's a flyer of a, commercial airline. But a little ridiculous by Intel. But anyway. Yeah. So, but yeah, my parents were a part of a health plan and they were incentivized to wear their Fitbit to track all of their steps. And if they reach some number per month, then they got a $5 discount. And that was enough for them. Right.
Really?
Yeah. Well, it was enough for them because they're already very fitness centric and they wanted to do those things and they wanted like some carrot at the end of it. But recently their health plan has stopped that program because not enough people were using it. So I just think it's really fascinating to try to figure out what these reward mechanisms are. And they're usually, there can be one that works, but I feel like there's whole spectrum of personalization and motivation that not everyone has quite figured out yet, right? And it's probably very startup specific.
Oh, I totally agree. And the reality too is there's another issue. It's just, do you want to do it? Like, do you really want to walk 5 miles a day? Like, for some people, I have a dog, so walking 5 miles a day isn't that hard for me, right? But for someone who is sedentary, like walking to the refrigerator when your feet hurt is a task. That is a thing. Like, my dad has some issues, and like, to get him just to do his laundry on his own, $1,000 wouldn't be enough of a reward. Right. You know, like, so it's like the money, and they've proven this time and time again, money is not a motivator for 99% of people. And so, like, you got to find something else that fits where they're at. And I think that that's the hard part.
I got it. I think that's great. Great insight. Definitely. Yeah. I don't think the money is enough either. It's just, man, I mean, that is the question. You talked about different ideas at different times, and probably timing matters, right? So before our current, several year generation, wellness was not a thing, right? Watches were not a thing, wearables. And then you go back 10 or more years, and there's Google Health Vault trying to get into the game of personal health records and centralizing everything in one place, and people didn't care at all, right? And now I feel like we're getting back into that era of, oh, well, now there's final rules, so there's a supposed reason for health systems to support sharing data, but and now people are questioning, do people really care, right? Do they care enough to centralize it on iOS or whatever the next vault is going to be? But yeah, do they care is the big question when it comes to motivation and behavior change. Yeah,
we'll see.
Yeah. We'll see. So on that note, Tim, I would love to ask you just a couple of big picture questions. We've talked about a lot that American healthcare is not so much healthcare, but rather a sick care. So rather than keeping people well, it's completely oriented and aligned around treating people when they're sick. I would love to know, how do you feel about the current state of healthcare? And what do you think we need to do to make it more patient-centric in terms of cost or accessibility or wellness?
I think we need something new. Working with a lot of these big providers, they're not looking for something that's going to move a small needle. They want to move a big needle. And there's lots of cool ideas. I'm sure many of the people that you guys are working with who have not billion-dollar ideas. They're not going to save an organization billions of dollars, but they could help 10,000, 100,000 people do something very good for themselves. But again, like I mentioned before, that requires new business models. Imagine if you had $200 a month from your health insurance that you could do whatever you wanted with. Like, that would be a really unique way. And it was free to you. Like, you're already paying for this service. I know these are happening in some employer healthcare systems, but that would be neat. But I don't think that people sell these things enough, right? Like, they just don't know how to communicate to consumers in a way that's very important. So, like, you look at Noom, like we talked about earlier, like, Tony Robbins can sell something because you believe he's going to change your life. Right. Like, Noom, you believe it's going to change your life. This digital wearable thing that actually can change your life, you don't believe it'll change your life. And that's a big problem.
Right. Yeah, no, that's super interesting. And I think that's where these direct-to-consumer models are interesting to follow, because it really is flipping who determines what is valuable in terms of care. And I think the examples that you've mentioned, and then all these emerging direct-to-consumer models, whether it's primary care or LASIX, and of course ED was like the big home run early on. It's just going to be super fascinating, because that is the market determines what is valuable for me in terms of my care.
Yeah. Well, and the awareness of it too as a consumer, right? Like there's a billboard on ED on my, like going to my house every single day, you know? So if you have that problem, the odds of you making that phone call go up exponentially.
Absolutely. Yeah. No, I get 10 emails and 3 spam calls. It seems like every week I'm not.
Totally.
Yeah. So not even just billboards. It's a random person.
It's like, you know, you might get diarrhea or death, you know?
Oh, gosh. Oh, well, yeah. Those people don't include the disclaimers. They don't have that button, man. This is a big idea.
Not yet.
Right.
Not yet.
Okay, so that's the patient side. And so recently, A16, they said that within healthcare, since the pandemic, a transformation that would have taken decades is unfolding right now. So in taking out your crystal ball, what area of healthcare innovation do you think has the most opportunity for entrepreneurs? Not necessarily the impact for patients, but I mean, what is like being enabled and transformed right now that you think people should look at?
So I really think that the digital device telemedicine space is going to blow up at some point. I think that I'm not sure what's holding it back, but if you could walk into a little cubicle, put your arm in a thing like we used to do at Walgreens, and it tells you everything that's wrong with you, like that's going to happen. I know Theranos is a thing, but like at some point that's going to exist in the next maybe 30 years. And it's going to be like, print out your receipt, go put it in the vending machine, and here's your medication. Like that's going to happen. I think that diagnostic tools are going to be much more consumer centric in the future. Like you may not have an x-ray machine at your house, but like, why do you need to go to a hospital to get an x-ray or an MRI? Like that's, again, I don't need to wait in line to stick my arm in a thing and follow a tutorial. Like there's just lots of things that don't need people. And I feel like in the future that's going to happen. We're seeing lots of cool AI things come that can like diagnose cancers, and like there's literally, you're just going to like, I feel like maybe this is what's going to happen. The airplane industry is going to dominate, and you just walk through the machine and it's going to be like, you've got cancer. Oh, and by the way, you're good to clear this thing, right? Like there's going to be something as simple as that is going to do our diagnostics in the future. And so someone's going to crack that. I don't know who it's going to be, but.
Yeah, no, that's amazing. Yeah, I'm just like thinking back to even the original Total Recall, where they had that walkway you could pass through that shows you everything about the person, and of course everything that they're packing in their clothes. I think you're absolutely right as far as those types of things being more accessible, more autonomous, which hopefully actually creates the space for the health professionals to consult, right, more than interpret what a result could be, which I think would be great for a lot of people. I think that's why there has been this big evolution for some towards like the coaches, the wellness professionals, the masseuse, the naturopath, because they really do consult with you and individualize versus just being a workflow step depending on what your readout is. I'm hopeful to follow those trends.
Well, I think I call it triage,
okay.
Right?
Yeah.
Like I hurt my foot. How bad is it? Can I go and see a naturopath? Can I go see someone, I'm going to say lower on the totem pole, however you define
right.
that. Or do I need to go see a professional? And that's kind of where general healthcare is at, right? That person is a triage machine. And I don't feel like we need those people, right? Like in the future, we definitely won't need like I need a foot doctor. Like I don't need 5 people to tell me I need a foot doctor. I already know this, like, and if you need the check system, you just go, go to the airport, right? Like,
right. And go to the airport. That's funny. Yeah. Oh man. Okay. Well, Tim, I just kind of have 3 rapid fire questions for you to close. Maybe let's just focus around pitches. Okay. So pitches you've heard or heard others give as your time and accelerator, or given yourself, although hopefully not for some of these. What's the kind of the funniest pitch you've ever heard without necessarily naming the company?
Oh man. That's a hard one. I heard somebody, I'm not going to go into details in case they ever hear this, but like it was a class. They wanted to raise $5 million to do this class. And like, it's like one of those things that you can literally do on your phone today. Like it wasn't funny, but it was like one of those, like, what? Like, it was kind of sad, but I'll go with that.
Right. They're like, with our app, you can view your call history.
Yeah. Yeah, totally. Yeah. You're like, and you can text people. You're like, can't we do that already?
Right.
Like, not with your left hand. You're like,
right.
Oh,
Exactly. Okay. Got it. And then, so how about your most memorable pitch as executive director of Park City? Again, you don't have to name the company. That's up to you. But just like figuring out what is memorable in a good way about it.
Yeah, that's a tough question. I see so many. I really like when people walk away and you're like, that's cool. I can't give you an example, but it's just when there's a feeling that you get when I'll say that actually that healthcare company most recently that explained something super complicated in a way a 5-year-old could understand was a really cool moment.
Right. Yeah, and that makes sense because, healthcare I think is inherently something that people don't necessarily understand, but even if they do the WebMD thing, so they can talk to their physician, they don't know how to say it, right? So I think that type of humanizing what is going on with, your body, your condition, and what to do is a big deal because most people don't have the ability to learn or the thought process, or if they do have those two things, the ability to articulate it and have a productive conversation with their physician.
I totally agree. Yeah. And then they come up with some new word and then you're like back to square one. You're lost.
Right. Yeah. People get hung up on words and technicalities when it's just, I'm trying to report my symptoms, man. Right. Or woman,
yeah. You're like, all right, there are two bones that do this. Mine feels like this.
Right.
Like, okay.
Yep. Cool. Well, Tim, I am immensely grateful, appreciative for you being on our podcast. I think it's amazing to have known you in high school and now learning even more about your journey as every side of the table. So entrepreneur and then angel investor and running an accelerator, to glue those two things together and writing a book about it really blows me away. And just very grateful for you sharing your learnings with us.
Yeah, well, thanks for having me. And yeah, it's cool to reconnect after so many years and then end up in a totally random spot. So
yeah. Well, let's make it less
awesome.
random going forward. But absolutely.
Let's do it.
Okay. All right. Thank you for your time, Tim. Yeah.
Thank you, guys.
Have a great day.